Hello, everybody. My name is Matthew Squire. I'm the head of health at Palucca University of Dance in Dresden, in Germany. Today, I have two guests with me, Dr. Stephanie Potrek and Mrs. Laura Graham, the ballet mistress. And I'd just like to introduce you first. Dr. Stephanie is a former internationally trained dancer whose career ended early due to a spine fracture, long before dance medicine had the support structures as it has today. So she studied medicine across Germany, France, Switzerland, and the UK, worked in human genetics, global health, and then found her way back to dance and qualified in sports nutrition while on a sabbatical in Australia. She founded Oz Dancers Overseas, a global telemedicine clinic supporting dancers, primarily in ballet, with a focus on REDS, hormonal health, and eating disorders. And she's currently vice chair of the IADM Special Interest Group Dancer Hormone Health and continues to advocate for evidence-based, athlete-centered care in dance. Laura started dancing at a very young age and was performing already aged 11. Where she was born in America, she went to the Joffrey Ballet School on a scholarship and then had a bad injury with her metatarsal area. Since then, after that, she went to the Royal Winnipeg Ballet, worked for 12 years there, and worked up from apprentice through the ranks right up to principal, touring many weeks in the year, international, and a very wide career and a repertoire, a very wide repertoire. Then she came over the pond and joined Bill Forsythe in Frankfurt for 7 seasons. And then after finishing that performing career, she taught for 4.5 years and then asked to come to the Semper Opera Ballet, where she founded the company, not founded the company, but developed the company. And for 18 seasons, she was ballet master and choreographic assistant and continued to stage Forsythe productions all around the world. So welcome, ladies. Very nice that you're here. Thank you for being here today and for helping our students. So we're going to talk about hypermobility. And Dr. Stephanie, first question for you. Hypermobility is a medical term that refers to a syndrome. It's not about dancers having a big range of movement, correct?
Exactly. That's a really important question because the terminology actually really is confusing. So in a medical sense, hypermobility does not mean just being flexible. Anyone can improve their range of motion with training, like dancers do this all the time. But you can never stretch yourself or you can never stretch your way into a connective tissue disorder, what hypermobility basically is. So when we speak about hypermobility, clinically, we usually mean Hypermobility Spectrum Disorder, so HSD, or Hypermobile Ehlers-Danlos syndrome, which is hEDS. These are heritable connective tissue conditions, so we don't know all the genes yet, but they present in a way that we think these conditions must be inherited. So we find more of them within one family, for example. But also this name is actually misleading because it's not just about bendy joints. Connective tissue is everywhere in the body, like literally everywhere. So these conditions can also involve gastrointestinal issues, cardiovascular symptoms like orthostatic intolerance. Anyone getting dizzy doing a forward port de bras first thing, during pliés? Yes, welcome to the hypermobility world. So skin fragility, blisters on my feet would always hear like, oh God, it would take ages until they would heal. Fatigue, pain, exaggerated pain, chronic pain, and even differences in the nervous system or how the nervous system regulates stress and how the brain responds to the way or to the world that we live in. And so here we have a huge overlap with neurodivergent conditions. So hypermobility as a medical condition is not something you can get from stretching a lot. You can increase your flexibility, but a systemic connective tissue disorder is something you are born with and something that definitely affects more than your joints.
Right. And you were both born with this condition, right? And you've since now had it understood a lot more about it. Laura, can I ask you, how did it feel and what did it look like for you as a student dancer? What did you encounter and how did it benefit you, or what were the counter productive sides of it?
Well, firstly, I am so thankful the world is finally looking into this. Because when I was younger in the States, there was no clue about this. So it was kind of like you were viewed for your physical aesthetic. And luckily, I was muscular and strong. So that meant my muscles were working overtime during my training, and they kept telling me, why are you working so hard? And I was like, well, I don't know, I can't stand up. Pros, I had luckily a lot of coordination, and I think, I don't know, the research isn't out. My body thought before my brain. I was very quick seeing and doing, so I was very coordinated, but I always had pain. I could, like I said, see and do. And I was always rolling over my ankles and just kept going. It was just a part of life. And it's not something you were aware of. And maybe that's the positive aspect, because I didn't put some sort of thing, oh, because of that, you can't do that or you're unable. So I learned how to figure my road out to the goal when I have to say, honestly, I looked at everybody else in class. I was like, why does it look so easy for them? But of course, New York, you don't show anything. And I needed to figure out my own way, which perhaps is a positive aspect of being the director of your career. Pros and cons.
So without a label, without a screen shot on your forehead that said, I have hypermobility, that was not something you had to fight against. You just had to work with it. Mm-hmm. Right.
Yes.
Were there any negative effects during that time? I just mentioned rolling your ankles frequently. Yeah. Were there other things like stability on a standing leg or other things to do with dance?
With dance, one thing that came to my mind when thinking back, I remember when I first went on point in the regional company, quite a young age. My teacher remarked that, oh, I have such a high hip quality. And I think it was the body adapting and thinking on its own. So I went up on point from a center and not just the ankles. That's one thing that came to my mind, which is interesting as a positive. And I just needed to, as the years went on, training, do a lot of extra subtle work. And due to an Achilles tendonitis, I started having massages at age like 15. And that started me en route to understanding how to work with it, unknowing, just innately, body thinking.
Mm-hmm. Yeah. So you were very much on your own and on your journey and learning by doing, right?
Yes.
Yeah. Stephanie.
Trying.
Yeah. Stephanie, when you see dancers and hear from dancers that they're feeling these things, how do you explain to them that that differentness is part of their condition?
I usually explain that, and I love what Laura just said. Her muscles were working all the time, and she was very muscular. So in hypermobility, our joints are inherently less mechanically stable, so muscles are definitely working all the time. So that wasn't just a feeling, that is actually really a fact. And that very often means, of course, does fatigue set in earlier because muscles are working all the time, and working muscles, they are expending energy. So, and that is basically before class or rehearsal even starts. What Laura was just saying, this persistent pain or rolling her ankles, that's not mysterious. Her body was working harder in the background just to maintain alignment and control, and then add on top of this classes, more classes, rehearsals, depending on whether you're a school or a company, high aesthetic demands, and very often also inadequate recovery, so very short recovery periods, because there's no other sports, if we just think of how the body works physiologically, dancers are athletes. There's no other sports discipline that has just a night in order to recover and then go on with classes and rehearsals all day long the next day, 6 days a week, right? So what I also loved was Laura saying she started getting massages from the age of 15. I think it was 15 or 16, right?
15.
We got 15. Yeah, absolutely. I love it. I couldn't love it more because exactly. It gets the nervous system out of fight or flight mode, which as a hypermobile dancer, you're very often in. So managing things like fatigue, injury risk, rolling ankles, not fueling enough, not because you're not being aware that your energy baseline is already, or the energy expenditure baseline is already higher than in someone without hypermobility. Poor recovery or very short recovery, insufficient recovery, and then pain sensitivity. This can be something where dancers easily get labeled as weak when actually it's just I'd say physiology mismatch between tissue type, training load, and energy intake. So that's usually the three big areas we're looking into when we start working with the hypermobile dancer. And unfortunately, it can make fear dancers like, oh, I'm different to anyone else, and different very often means like I'm not as good, or I'm not as strong. I'm just not cut for it.
So you just mentioned about how the fueling is important too, right? So Laura, did you notice, I think when I think back to the first answer, Stephanie mentioned about the digestive system being another system inside the body which can be affected by hypermobility. Did you have issues, concerns, or problems with your eating habits and fueling patterns?
It's very interesting that this research is coming out because also as a little girl, I spent many nights for, I don't know why, in sleeping in the bathroom because of just having a night of throwing up. And just like a little girl eating with the family, a normal meal, we don't know why it happened.
Okay.
And I'm healing my stomach to this day.
Right. I mean, it's a systemic thing, right? It's inside you and it's not changing because it's nothing to do with what you do or don't eat. It's the system working for you, right? The tissues, as Stephanie explained at the beginning. Stephanie, being sick through the night as a young person, that's could be also the high stress levels, right? This fight and flight constantly. That the body's feeling the say, damage or stress from training, and then not being able to just switch it off, right?
I always find the pendulum effect is extreme with us.
Yeah, it absolutely is. One day you are fine, and the next day, and then training wasn't even like too strenuous, and the next day you wake up and you're just like, I don't know, as if a lorry had hit you during the night, or you've been in a, a boxing fight or whatever, and it's just like, wait, hold on, what did I do? But what I just wanted to say, I actually had the same problems, but only as a med student. So when I was in my 20s, I would throw up during the day for years, and it is because the sphincter muscle, so the muscle that opens and closes my stomach, so connects my stomach with my esophagus, it's pretty weak, and when I'm stressed, the innervation of this muscle is even worse. And then food gets out the wrong way, I would say. I mean, it's not nice.
Wow. So some of our students might be.
Me too.
Okay, right. So if the two of you have it, some of our students listening might also recognize parts of this too. Would it be advisable to go and get a diagnosis? If yes, where and how? Or is it better, like Laura explained at the beginning, not having a label from an early age was a bit like, giving you freedom to just not say there's something wrong with me, because at the end of the day, getting a diagnosis always sounds like getting something wrong. So it's either a pass to say, no, it's normal for me, or it's a label. I don't know.
You want to go first? Okay. So From clinical practice, I would say it does make sense to get a diagnosis because for many, and I mean, most of them are between 15 and 25 when I work with them. It helps them understand their life in hindsight and still be early enough, be proactive in terms of protecting their career and the longevity of their career or sustainability of their career. These days, as we are aware that not just the hypermobile dancers, but any dancer, just generally speaking, should be having a healthcare team. I know we know this from companies like the Royal Ballet, the Oz Ballet, and so on. So it's not something that is so like extraordinary anymore. So really getting diagnosed and getting specific care, you're not even so different from any other dancer or, in an ideal world. But it does help because it does help understand life in retrospective. And it absolutely supports you in all things longevity and sustainability of your career. So I would go and get one, I would say.
Thank you. And Laura, would you also recommend that?
I agree. I would have looked back and would have loved a bit of support, not feeling like, as Stephanie said earlier, other than like I have problems and I'm afraid to talk about them and be judged and more old-fashioned mentality. I think awareness is empowerment, which gives us more self-confidence, and then we can develop our tools out of knowledge and have some support, and you can gain information and then formulate more questions and be a different type of director of your career with empowerment.
Okay, thank you. And you both mentioned longevity during your careers now. So just, I think as we come towards an end here, what would you advise students who, our students listening today are the ones who will be performing in companies very soon, maybe even in September or in the next year or two. And as they make that move from a student into a professional environment where there might not be a health team available anymore because many schools are working in this direction, but many companies sometimes don't have a health team available. So could you make one, break a lance, Laura, for one aspect of what would be important based on your experiences for that young student?
Like physical and support. Well, everybody's a bit different. I started a floor bar also at 15 in New York, and I wouldn't have had a career without it because it wasn't about using the dominant muscles, which are like, I'll do it. And you're like, no, we talked about this. Stop it. A floor bar is then using just what you need. We talk to ourselves in there. Hello, foot. Thank you. Doing bar in the pool. And that also is a bit the gyrotonic, which I'm certified in gyrotonic, which blew my mind near the end of my career. It's like it's a little easier to just find the supporting muscles, and it kind of teases the dominant muscles not to take over.
Thanks.
There's so many different modalities now, though. Yeah.
But these are, as you say, 3 examples, but floor bar, gyrotonics, and working in the pool with water resistance. These are 3 great principles for building joint stability and intrinsic strength. Okay, so thank you for that advice. That's invaluable. Stephanie, what would you say?
Very similar in terms of strength. For me, just an example, what worked best for me was being really strong in this end range of motion. So like, doing Cossack squats, where these side lunges where you sit with your butt on the floor. I wouldn't just be doing them in order to sort of test my flexibility. I would be doing them with a 10 or 15K dumbbell so that I'm still flexible but strong in this end range of motion. So this perfectly worked for me. I think everyone has to find the approach that works best for them, but definitely be strong in your end range of motion and be strong in your body in general. Fuel strategically, know that you need more, which is so hard in an environment that is leaning on restriction more often than it should. build recovery into your life or into your week on purpose. If you know that you're only going to stand 4 hours in rehearsal and not barely be able to mark anything, and you know you're not going to cover for anyone anytime soon, ask whether you can go home. That's not weakness, that is just being smart and intelligent, taking care of yourself, and learn your warning signs.
Yeah.
Don't push through.
Yeah. Fantastic. All right. So, ladies, I thank you so much for your insights, for your experience, and for your knowledge. Yeah, it's been a marvelous conversation. And I wish all of you students all the very best. And thank you very much.
Good luck.